AI in urology, that's the section I participate. And this is the famous statement from Mr. Spock: change is the essential process of existence. That means everything is changing. So don't think AI as the final frontier in urology. It is not. Rather, it is the next frontier. As I describe all those exciting technologies, they are coming up. So AI won't be the final one. It will be the next one, and then there will be other stuff. So let's move to telesurgery. Dr. Albala explained this very beautifully. And of course, the telesurgery, patient will accept telesurgery if it is safe, effective, and there is perceived benefit to the patient, and also involve less travel. You can easily train your local surgeon very effectively using technology. As he pointed out, some regulatory and medical legal issues has to be worked out. The main obstacle for this technology is the time delay, the latency. If it is greater than 300 milliseconds, it's not acceptable. Now, the bright side is we have 5G networks, and that will solve the latency issues, and have gigabytes per second download speed, so it should not be a problem. And it is more economical than the asynchronous transfer mode (ATM), which was used in that year 2001 surgery that Dr. Albala explained. And the 5G networks can be the backbone for a democratized robotic telesurgery. That means everybody have access. So practice demands evidence, and evidence established practice. So that's a sort of a summary that I can put you here in front from that talk. And this is the one I discussed: urologic cancer, the use of AI. Advantages are very clear, widely adapted in urology. There are way too many to discuss in 10 minutes. More accurate in prediction and more explorative and analyzing large data cohorts. That's probably where I think AI will probably take over, such as analyzing the dark genome and some of these large data sets. AI is going to do a fantastic job. So result in significant time savings and cost reductions, use of these technologies, and help facilitate evidence-based and individualized patient care. Challenges are lack of real-world application. That's probably the main obstacle. The FDA is basically, sort of like saying, hey, this is good. Most of the validation done in internal data sets or limited to a single institution. No external data sets were used, no randomized trials, so that's the main obstacle. Then you have to address ethical concerns, data privacy, and human oversight. Now, fortunately, FDA has come up with some guidelines. There are guidelines suggest for adaptive design in clinical trials. That means, you start the clinical trial, you can begin to tweak your statistical analysis and some of the parameters, but without compromising the endpoints. Usually the FDA give you the primary and secondary endpoints where you have to meet the targets. But what they're saying is if you use an adaptive design in clinical trials, can provide real-world evidence to assess the performance of your AI system. So the key thing I emphasize here is, again, at least up to within the next 5 to 10 years, the use of AI, striking a balance between AI capabilities and the clinician expertise, is crucial. And that's what that the hesitancy comes from. You don't want to cut off the human expertise. The doctors have to be part of all the decision making. So that's for that. And Dr. Carlson's summary here: use of ChatGPT and other language-based AI for academic urologists. She outlined some of the advantages: translation for non-native English speakers. There are good publications in French, German languages, and improve grammar, spelling styles. Save time, and can summarize the text in a very effective way. But the good, the bad, and the ugly. The good is can improve scientific writing, can summarize information and save time. The bad would be, of course, if you are a reviewer, you don't want to upload grant application, then come up with a review for this thing. And of course, risk of sharing sensitive information such as the protected health information, etc. The ugly will not follow privacy concerns, irresponsible conduct of research, fake content, fake references, and plagiarism. So that's that. So that's basically from a summary of AI applications in urology on the section.